This is wonderful. Thank you so much. I'm a nurse practitioner practicing at a medical center in a rural area. About 33% of our population is Medicaid. This is one of the things I have on my block, is creating something like this, but you guys have done it, so this is wonderful. I think the really important piece that I've been finding out for women is with these people, I have people who are living in motels, cooking on hot plates, refrigeration the size of a little dormitory, thinking of things, putting food in the cooler outside. Us, we have snow, so we can do that. But I think one of the things that's missing, if somebody could create a cookbook for, if you have $400 a month to feed a family of 4, how do you do that? So that was just one of the many things that I'm thinking of, but this is wonderful because they're all reading about, oh my God, I think I'm losing my baby, oh my God, I'm this, oh my God. It's like, how about focusing on what you're eating? Thank you.
Hi, I'm Josephine again, Chaloni. I really applaud the interactive application. The women in our state have reported back to us, at least in public health, through our public health programs, that they really like self-directed education, where they decide what questions they're asking and what information they get back. They've really loved Text for Baby, which is a MCHB initiative with the other partners in our state, where women get messages that they read themselves, no one talking at them, they decide if it's important to them, and then come back to us and ask questions if it's something they're really particularly interested in. So my question is, will we as like state agencies or local health agencies be able to put a link to this on our we have consumer components of our websites. Our participants like to get their own information again when they want and where they want. And also, would there be any opportunities perhaps to partner with Text for Baby to get this out at pivotal times during that messaging cycle through pregnancy and through the first year? Because I think we have the opportunity to, again, have women use it in through many avenues.
I'll answer that, Josephine. Yes, we're finalizing the interactive infographic right now. So once it is finalized, it'll be posted and available for download by anybody. So you can just upload that to your group's or organization's website and use it. And the other products will be available on PDF for download. And we'll also have instructions. If somebody wants to order them, we can make those arrangements as well.
This was one of our stealth efforts. I call it stealth because we saw that so many websites had erroneous information. We wanted to create something that was so attractive and so available. I didn't even know what an infographic was when we started this, but that was so attractive and so available that many websites would choose to use this instead of what they were already doing, and that this was what women would gravitate towards, so that we had some more control of the message in a very positive way. And I'm glad to hear about the self-directed education, and it's time we did more like that. But we're out of money.
Hi, Andrea Sharma, CDC. Kind of just following up on some of the previous comments, basically, is the infographic available on an app, or can you actually see it on a smartphone? Because I think what we've learned from Text for Baby and some of our other work is a lot of low-income women in particular have smartphones, but not necessarily internet access. And so I think it would be important. And sort of a follow-up question, is there a tracker, just a gestational weight gain tracker, where they can actually enter their weight information throughout the pregnancy to see where they are along the way? Is that a piece of it? Or
yeah, the technology was designed so that it would go across different platforms. So, and that's part of what's being worked out right now. So it will be available on iPhones and iPads and PCs, whatever platform you have. We tried to make it uniform. We don't have a built-in weight tracker. It's something I can suggest as a possibility to add to it at some point to make it more adaptable.
But I think Canada does. So if you go to the Canadian website, I actually think they have the weight gain tracker. because they took our materials, from the report, and actually were the first ones to develop a web page that actually had the BMI calculator and stuff like that.
I mean, they're out there. There's definitely apps
Yeah.
out there, but it would be nice to link so it's searchable.
Well, thank you very much for your questions and comments. We're going to bring this session to a close and take a break until 10:45, and then we'll begin again. So we'll see you back in this room soon.